the endothelial system and inflammation, eosinophils, basophils, and platelet cells, and finally the pathologic condition, leukopenia and leukemia. And leukocytes or white blood cells are the mobile unit of the immune system, or the mobile cells that can move toward the area of inflammation or infections and provide defense against the foreign substance or invading substance. They are on average 7,000 per each microliter of blood in an adult man. Besides the stem cells that, as I told you, the periviescision that differentiate finally to erythrocyte, there's two lineage of WBCs. Lymphocytes lineage and myelocytes lineage. A myelocyte lineage finally differentiate to neutrophil, basophil, and eosinophil, and lymphocytogenesis finally produce lymphocytes and plasma cells. Plasma cells are the mature form of lymphocyte that can produce antibodies at high rate, at rapid rate, okay? So plasma cell and lymphocytes are part of the lymphocytogenesis, and the neutrophil, eosinophil, basophil, and monocytes are part of the myelocytogenesis. You can see these 6 types of WBCs and their percentage in our blood. Neutrophils is about 62%, eosinophil about 2.2%, basophil about 0.4%, monocyte 5%, lymphocyte 30%, and plasma cell that, as I told you, are the mature form of B lymphocyte that can produce antibodies at a rapid rate. These first 3 types of WBCs are polymorphonuclear and have the as you can see here, granular appearance, and because of these 3 types, I mean neutrophil, eosinophil, and basophil, collectively known as granulocytes, okay, or polymorphonuclear cells. These 3 types and monocytes act as phagocytes that can phagocytosis and provide phagocytosis and ingest foreign substance and invading substance. Platelets also are part of these WBCs, which is fragments of another type of cell, which is called megakaryocyte, okay, which also produce in the bone marrow, like another WBCs. Another point to mention is that these myelocytic lineage is produced in the bone marrow, but lymphocytic lineage is produced in the lymphogenous tissues or lymph tissues. For example, in the lymph node, in the or lymph gland, spleen, thymus, and tonsil. Okay. This slide shows you lifespan of white blood cells. Granulocytes, I mean neutrophil, basophil, and eosinophil, is normally between 4 to 8 hours circulating in the blood and about 4 to 5 days in the tissues. But in the time of serious infection, the total lifespan is shortened to few hours because all the WBCs can migrate from the capillary, from the blood to the tissues, okay, to area of the infections or inflammation. So in the tissue, they can, their lifespan is about 4 to 5 days. Monocytes have the longer lifespan, between 10 to 20 hours in the blood, and in the tissues, in the form of macrophages, they can live 4 months because macrophages are the mature form of the monocyte, okay? And platelets in the blood are replaced about once every 10 days, and lymphocytes have lifespan of weeks or months, depending on the body needs for these cells. Okay, so this slide shows you the lifespan of the different WBCs. But what's the lymphatics? Lymphatics serve to collect plasma and its substances that exuded or leaked from the capillaries into the interstitial space. Okay, so the lymphatic or lymphs is the plasma that is leaked from the capillary into the interstitial space. And lymph vessels can collect this lymph and it has some valves and can traverse or transport lymph through the lymph nodes along their course. And the outer structure of small lymph vessels are different from the capillary because they don't have any fenestration and they have very little basal lamina and the junction between endothelial cells are open with tight interstitial, with no tight intercellular connection. So lymph can easily move from interstitial space and collect to the lymph vessels and come back to the systemic circulation by these lymph vessels. So they drain from the body tissues by a system of vessels that coalesce and eventually enter the right and left subclavian veins at the junctions with the respective internal jugular veins. Okay, so this is explanation of lymphatics. There's some slides just for your information and is not included in your exam, okay? This is one of these slides. This is just for your information to know what lymphatics and lymph and what's the lymph vessels and how they can collect the lymph and combat the interstitial fluid to the systemic circulation. Please write down the slide that is not included in your exam and it is just for your information. This is one of these slides. Neutrophil and macrophages. As I told you, these cells are collectively known as phagocytes. That can attack and destroy invading bacteria, viruses, other harmful or invading or foreign agents. The neutrophils are mature cells or mature WBC that can attack and destroy bacteria even in the circulating blood as well as in the tissue. But as I told you, monocytes are immature form of the macrophage, and this convert to macrophage when enters the tissue, and the tissue macrophages are mature form of the monocyte that can attack and destroy invading agents. Okay, but the monocytes are immature cells. Once the monocytes enter the tissues, they begin to swell, sometimes increasing their diameter as much as 5-fold to as great as 60 to 80 micrometers. the first size of the monocyte is between 10 to 12 micrometer, and then they become mature and differentiate to macrophage form. Their diameter increase to 60 to 80 micrometer in the tissue. And they, both of neutrophils and monocytes are attracted to inflamed tissue or infectious area by a phenomenon which is called chemotaxis. Okay? As you can see here, the inflamed area or the area of infections release some substance that attract these WBC to this area, okay, and they can penetrate and pass through the pore of the capillary by diapedicers or squeezing through this pore and be attracted to this area, and in the tissue they can move by any movement. But what's the which substance can observe or attract these WBCs are shown here. For example, some of the bacterial or viral toxins, degenerative products of inflamed tissues, or several reaction products of complement complex that we will discuss about this complex in the next slide, and several reaction products caused by plasma clotting in the inflamed area. So all of these substances can attract monocytes and neutrophils to the area of infections or inflammation. As I told you, neutrophil and macrophage can squeeze through gaps between endothelial cells of the capillary membrane by diapedicers. And after they enter the tissue, they can move through the amoeboid motion. Okay, so because of this, we usually say that WBCs are mobile units of the defense system of our body. What is the complement complex? This slide is just for your information to know what is complement complex, and it's important in our defense system. Complement complex is a collective term that describes a system of about 20 proteins, which many of them are enzymes. It enhances the action of antibodies and phagocytic cells' function in neutralizing and destroying pathogens. When an antibody binds with an antigen, a specific reactive site on constant portion of the antibody becomes uncovered or activated, and in turn binds directly to C1 molecule of complement system. Okay? After that, C1 enzymes activate successively increasing quantity of enzymes in the later stage of the system. And among the more important substances of the complement complex, and the more function of this substance, you can see here, they are listed here. For example, opsonization and phagocytosis. For example, one of the products of this complex is C3b that strongly activates phagocytosis by neutrophil and macrophage, and this action is called opsonization. Or another function of complement complex is lysis, or they attack to the bacteria or infectious membrane agents membrane. Okay. Or another function is agglutination, which they cause invading organisms to adhere to one another, and the exposure to phagocytosis by the WBCs. Or another function of this complement is neutralization of viruses or chemotaxis. As I told you in the previous slide, one of the substances that observe or attract WBCs is complement complex, and the fragment or substance C5A initiate the chemotaxis in the chemotaxis in the area of inflammation or infections. And finally, activation of mast cell and basophils in the allergic reaction. Okay, and we will discuss about mast cell and basophils in the next slides. So this is a summary of explanation of complement complex and its main function in our body, and it is just for your information. What is phagocytosis? Phagocytosis means cellular ingestion of offending agents. As you can see here in this figure, these foreign agent or infectious agents approach to these phagocytic cells, which might be monocyte or macrophage or neutrophil, and attach to these the membrane of these cells. And as you can see, there are some pseudopodia that can, as you can see here, entrap these foreign agents and create a vesicle which is called phagosome, okay, or phagocytic vesicle. And then lysosomes, membranes fuse to this membrane, of this phagocytic vesicle, and can drop its enzyme or granular into this vesicle to form digestive vesicle. And finally, after digestion of this agent, this invading agent or this bacteria, the microbial debris can be excreted, and the macrophage can also become can survive for longer time. So this is phagocytosis and the procedure of phagocytosis, but it is depend on three selective procedure. Unless our natural cells, our natural structure might be destroyed by these phagocytic cells. What is these three selective procedure? This is listed here. For example, if the surface is rough, the likelihood of phagocytosis is increased because the surface or the cell membrane of our natural cells are usually smooth, okay? Another factor that increases the possibility of the phagocytosis is that most dead tissues and foreign particle or invading agents have no protective coats, okay, unlike our natural body structure. And the antibodies adhere to bacterial membrane, making the bacteria especially susceptible to phagocytosis, okay? So it usually occurs based on these three selective procedure and can detect the foreign agent based on these factors. As I told you, macrophages are the end-stage product of monocytes that enter the tissues from the blood and are much more powerful phagocytes than neutrophils, often capable of phagocytizing as many as 100 bacteria and have the ability to engulf much larger particles, okay? Unlike the neutrophils that can just digest between 3 to 20 bacteria. And after digesting particles, macrophage can extrude the residual products, as I told you, and often survive and function for many more months, unlike the monocytes, because after digestion of invading agents, neutrophil usually die and become inactivated, but macrophage can survive for many more months. So because of these two reasons, macrophages are more powerful phagocytes rather than neutrophil. And both neutrophil and macrophage contain abundance of lysosomes filled with proteolytic enzymes. As I told you here, the proteolytic enzymes are usually inside the lysosomes, okay? And after infusion of the membrane of lysosomes to the phagocytic vesicle, they can digest the foreign agent or invading agent in the digestive vesicle. But apart from the lysosomal enzymes, neutrophil and macrophage contain another bactericidal agents. For example, these agents usually results from several powerful oxidizing agents formed by enzyme in the membrane of phagosome or by a special organelle which is called peroxisome. Oxidizing agents include superoxide, hydrogen peroxide, and hydroxyl ions. Okay, these three oxidizing agents are bactericidal in the neutrophil and macrophage. And there's another lysosomal enzyme which is called myeloperoxidase that catalyze the reaction between hydrogen peroxide and polarized ions to form an exceedingly bactericidal, which is called hyperchlorite. Okay, so these bactericidal agents can work besides the lysosomal enzyme to kill different invading or infectious agents. But what is the reticular endothelial system? This is the collection term of the monocyte macrophage cell system. After entering tissues and become a macrophage, as I told you, large portion of macrophages can be attached to the tissues and remain attached for months or even years and provide protective function in that area, okay? And when appropriate stimulation, for example, in occurrence of inflammation or infections in that area that these macrophages are attached before, they break away from their attachment and again they become mobile and be activated and respond to chemotaxis and all other stimuli related to inflammatory process. So, dear students, the total combination of monocytes in our blood, which are the immature form of macrophages, mobile macrophages in our tissues, and fixed tissue macrophages, and also a few specialized endothelial cells in some of organ, for example, in bone marrow, spleen, lymph nodes. They are collectively known as reticular endothelial system, and their other name is monocyte macrophage cell system. Okay, and we have a specialized macrophage system in different organs, especially that organ that are exposed to foreign or invading agents. For example, macrophages in skin and subcutaneous tissue is called histocyte, or the macrophage in lymph nodes. That's there's another important macrophage in lymph nodes, and they help that no infectious agent or particulate matter enters the tissue can be absorbed directly through the capillary membrane into the blood, because as I told you, the lymph in the interstitial space can be observed to the lymphs, and in this lymph can pass through the lymph node, and the macrophage in lymph node can digest these invading agents and prevent absorption of these agents from the tissue into the circulatory system. As I told you, the lymph flow to the lymph nodes located intermittently along the course of the lymph flow, and the foreign particles are then trapped in these nodes in a meshwork of sinus lined by tissue macrophages, okay? So they are really important to prevent entrance of the foreign agents or bacteria that are placed locally in a tissue from their absorption to the circulatory system. So this is macrophage in lymph node that's, as I told you, prevents this absorption into the blood. But as you know and as you learned in the respiratory system, we also have macrophage, particulate or specialized macrophage in the alveoli, and they usually really important to destroy some particles that are their diameter is less than 0.5 micrometer, and they can penetrate to the alveoli, and these macrophages are responsible to destroy these matters. But there's also another important macrophage in the liver, which are called Kupffer cells. As you know, large number of bacteria from ingested food constantly pass through the gastrointestinal mucosa into the portal blood. And before entering the portal blood to the circulation, systemic circulation, portal blood pass through the liver, which are lined with macrophages called Kupffer cells. Okay, they form effective particulate filtration system, and almost none of these bacteria or foreign agents from gastrointestinal tract pass from portal blood into the general circulation system. And this is really important to digest these foreign particles that are observed from the gastrointestinal tract. But a macrophage of spleen and bone marrow providing another line of defense against an invading organism that succeeds in entering the general systemic circulation. Unless all of these macrophage defense system and unlike all of these line of defense, if a substance succeeds in entering the circulatory system, macrophages of spleen and bone marrow are responsible to destroy them. What is inflammation, and what's the role of neutrophil and macrophage in inflammation? When tissue injured, multiple substances are released by injured tissue and cause a dramatic secondary change in the surrounding injured or uninjured tissues that is collectively known as inflammation. Which substance is released by injured tissue and cause this change? You can see this substance here. For example, histamine, bradykinin, serotonin, prostaglandins, several different reaction products of complement reaction or complement complex, products of blood clotting system, and multiple substances called lymphokine that are released by sensitized T cells. That we will speak about different T cells and their function in the next slide. So these substances that are released in the injured tissue, in the inflamed tissue, cause these changes, okay, in the surrounding tissues, which collectively known as inflammation. For example, they cause vasodilation of local blood vessels. They increase permeability of the capillaries. They stimulate clotting of the fluid in the interstitial space. And they also stimulate migration of large numbers of granulocytes and monocytes from the blood into the tissues. And also they cause swelling of the tissue cells, okay? And this is the occurrence of inflammation. Okay, this slide shows you different types of T cells and their function. This slide is just also for your volume of effect of inflammation, which is provided by fibrinogen clots. It's really important to prevent that this inflammation can spread to another tissues. So the tissue spaces and the lymphatics in the inflamed area are blocked by fibrinogen clots, so that after a while, fluid barely flow through the spaces and prevent is spread to another tissues. And as I told you, delays the spread of bacteria or toxin products. This slide and the next slide shows you different line of defense system against the invading of bacteria or foreign agents entrance to our body. The first line is tissue macrophage that work within minutes after entrance of this invading agent to our body. As I told you, they all are already present in our tissues and immediately begin their paralytic action or digestive action within minutes after inflammation and provide the first line of the defense system. As I told you, the tissue macrophages or macrophages that are attached to the tissue can be activated again after exposure to the foreign agent or inflammation by rapid enlargement and breaking loose from their attachment and become mobile, forming the first line of defense against infection. The numbers of these tissue macrophages are not great, but they are life-saving. Their action is life-saving. But neutrophil invasion to inflamed area provide the second line of defense against the invading agents that work within the first hour after exposure to the foreign agent or infectious agents. After exposure to these foreign agents or inflammation, or as a result of releasing substance from the inflamed tissues, expression of adhesion molecules such as selectin and intracellular adhesion molecule 1 or ICAM1 on the surface of endothelial cell in the capillary increase, as you can see here, okay? So the expression of these adhesion molecule is increased as a result of the releasing some substance from injured tissues. And then these WBCs, neutrophil monocyte, can attach to these adhesion molecule that is called margination, okay? And it facilitates the penetration of these molecules, these WBCs, from the pores between the endothelial cells, which is called, as I told you in the previous slide, diaphoresis, which is squeezing through the or sliding through the pores of endothelial cells of capillary membrane. Okay, so neutrophil invasion to the inflamed area occurs within the first hour as a result of increased expression. Shows you the third and fourth line of defense system. The third line is second macrophage invasion into inflamed tissue, and the last line is increased production of granulocyte and monocyte by bone marrow. That this production is controlled by some substances that is shown here, some of them that are more important, okay? There's more than 2,000 factors that have implicated in control of production of macrophage and neutrophils, but these five substances play dominant role. For example, tumor necrosis factor or TNF, interleukin-1, granulocyte monocyte colony stimulating factor, granulocyte colony stimulating factor, and monocyte colony stimulating factor, that all of these can be released from the damaged tissue, okay? And stimulate the last line of the defense, which is increasing the rate of production of granulocyte and neutrophil and monocytes from the bone marrow. Finally, after engulfing large number of bacteria, necrotic tissue, as I told you, all neutrophils die and they cannot survive more, become inactivated and finally die. And some of the also macrophages die, although part of them can survive for longer time. But these macrophage or neutrophil that eventually die after several days can be entrapped in the tissue, okay? Because a cavity is often excavated in the inflamed tissue containing varying portion of necrotic tissue, dead neutrophils, and dead macrophages, and also tissue fluid. And all of these substance in this cavity is called pus, okay? And these necrotic tissue and dead cells in the pus gradually utilize over a period of days, and end products are eventually observed into the surrounding tissues and also lymph, okay? Mainly lymph can observe these extra fluid in the interstitial space, okay? So this is the explanation of pus. Okay, dear student, do you need about neutrophil, yes, neutrophil and monocytes as phagocytic cells, but basophil and eosinophil is remained. As I told you, basophil is just the percentage of basophil in our blood is between 0 to 0.3%. So it's in people with allergic reaction, okay, and the number increase in this condition. The basophil in the circulating blood are similar to the mast cell in the tissue, okay, and both of them can liberate some substance in the allergic reaction. For example, they can liberate heparin into the blood and also release histamine as well as bradykinin and serotonin. These substances, bradykinin, serotonin, heparin, and also a slow reactive substance of anaphylaxis and several lysosomal enzymes can create the allergic reaction, okay, and provide the allergic appearance. As you probably know, basophil has some receptor for immunoglobulin E that cause allergic reaction when the allergen attached to the immunoglobulin E on the surface of the basophil. Okay, upon attachment of allergen to antibody, to this antibody, the basophil rupture, okay, and these substances is released from the basophil and can begin the allergic reaction, okay. So basophil and mast cells are really important to creating allergic reaction after exposure to allergen, different allergen. Eosinophil often produced in large numbers in people with parasitic infections. Okay, although most of these parasitic infections are larger than can be phagocytized by eosinophil, they usually release some enzymes that can digest these substances, these infections. So mostly eosinophils attach themselves to parasites by way of special surface molecules and release substances, different enzymes that can kill many of these parasites. Okay. One of these parasites that can be seen in developing countries and spread widely in this country is schistosomiasis that can be killed by different enzymes in the eosinophils. For example, hydrolytic enzyme, highly reactive form of oxygen, for example, hydrogen peroxide or anion or superoxide anion, which can be killed by these reactive form of oxygen. And another important factor that can kill this parasitic infection is larvicidal polypeptide called major basic protein from the granules. So eosinophils have different enzymes, different agents that can digest parasitic infections. And trichinosis is another parasitic infection that is because of the pork gall, okay, after eating the uncooked meat that can attack different muscles in our body. It is also can be digested by these different enzymes. So trichinosis and schistosomiasis is two important parasitic infection in the developing countries. And another important function of eosinophil is that it collects in tissues in which allergic reactions occur, okay? And it can be, and the substance that is released by basophil and mast cell during the allergic reaction can be destroyed by eosinophils. And also eosinophil that can attack to the complex of allergen antibody complex and destroy them. Okay, so basophil and mast cell create allergic reaction, But eosinophils collect in the area of allergic reaction to destroy substances that cause the allergic reaction and can destroy the complex of antibody allergen. So this slide, as I told you, explain the main function of eosinophils. Finally, the pathologic conditions related to WBCs are shown here and in the next slide. The first condition is leukopenia. And leukopenia is the insufficient production of the WCs by bone marrow, okay? And there's different factor can affect on the bone marrow and cause deficit in producing sufficient number of WBCs. For example, radiation of the body by X-ray or gamma ray, or exposure to drugs and chemicals contain benzene or anthracene nuclei, or some common drugs, for example, chloramphenicol as an antibiotic or thiauracil to treat thyrotoxin, and also various barbiturates can occasionally cause leukopenia. Okay, so leukopenia might be appeared as a result of different damaging factor as shown here, and as I told you, is insufficient production of WBCs by bone marrow. And another pathologic condition is called leukemia, which is uncontrolled production of WBCs or cancerous production of WBCs by bone marrow. And it has two types, myelogenous or lymphogenous types. Lymphogenous leukemia result from the cancerous production of lymphogenous lineage, and myelogenous leukemia is result of cancerous production of myelogenous lineage. It can be partially differentiated, for example, neutrophilial leukemia, basophilial leukemia, eosinophilial leukemia. But it's mostly this leukemia is undifferentiated, and more undifferentiated leukemia is more acute, okay, and can cause this within a few minutes, within few months, okay. The effects that leukemia has on our body is shown here. The first effect is metastatic growth of leukemic cell in abnormal area of the body. They also can invade surrounding bone, causing pain and a tendency for bone to fracture easily. And also, almost all leukemia eventually spread to spleen, lymph nodes, liver, and other vascular regions. And another important effect of leukemia is development of infection, severe anemia, and a bleeding tendency caused by thrombocytopenia or lack of the platelets, because the stem cells is replaced by cancerous cells, okay? And the number of WBCs and also number of platelets is not sufficient, as well as WBCs, okay? So in the leukemia, we can see infection, severe anemia, and bleeding tendency all together. And excessive use of metabolic substrate by growing cancerous cells is another important effect of leukemia, and this is just enough and sufficient to cause death of a patient. Okay, so this slide, as I told you, was about the